Overactive bladder is a common and often disruptive medical condition that affects millions of people worldwide. It is characterized by a frequent, strong, and sudden urge to urinate, often leading to involuntary urinary incontinence. People who suffer from OAB may find themselves constantly searching for the nearest restroom, experiencing disturbed sleep due to nighttime urination, and grappling with the emotional and social challenges that come with this condition. So in this video, let's explore 5 effective remedies and interventions to address overactive bladder, ranging from lifestyle modifications and exercises to medical treatments and natural remedies. Without any further delay, let's begin. There are 3 main reasons why an overactive bladder can happen. Number 1. Urinary tract infections. Sometimes bacteria can get into your urinary system, which includes your bladder. These bacteria can cause an infection, making your bladder irritated and swollen. This swelling can make your bladder feel like it needs to empty itself more often, even if it's not really full. Number 2. Uncontrolled blood sugar. When you eat too many refined carbohydrates, like white bread and sugary snacks or drinks, or have a problem called insulin resistance where your body can't use sugar properly, it can increase your blood sugar too much. So when your body tries to get rid of extra sugar, it makes you pee more, which can cause irritation and inflammation in your bladder. Number 3. Prostate enlargement in men. Men have a small gland called the prostate near their bladder. Sometimes, this gland can grow bigger and press on the tubes that connect to the bladder. This pressure can trick your bladder into thinking it's full, making you feel like you need to go to the bathroom more often. So as you can see, all these conditions are pretty serious and need immediate medical attention. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Now let's take a look at some of the most effective natural remedies for overactive bladder. Number 1. Pumpkin seeds. Pumpkin seeds contain some special stuff in them that can make your bladder work better. For example, they contain phytosterols. These are plant-based compounds with a similar structure to cholesterol. But the cool thing about them is that they have anti-inflammatory properties, which help reduce inflammation in your bladder and kind of repair it. Another thing in pumpkin seeds is magnesium. This essential mineral helps ease the muscles in your bladder and prevent unnecessary or abnormal bladder muscle contractions that make you want to pee. Pumpkin seeds also contain zinc, which helps strengthen your immune system and fight off underlying infections that could be causing your bladder to overreact. Especially for men, zinc is also essential for better prostate function and helps you avoid prostate-related issues that could cause UTIs or bladder infections in the first place. You can easily include them in your diet, either by simply snacking on them or adding them to your salads, smoothies, oatmeal, or Greek yogurt. Number 2. Varuna bark. Varuna bark is a special remedy that has been around for thousands of years and is traditionally used as a medicine against many health conditions, especially the ones involving bladder, kidneys, and urinary tract infections. Varuna bark has anti-inflammatory and antispasmodic properties. This means that it helps reduce inflammation in your kidneys, your bladder, or your urinary tract. Its antispasmodic properties help relax the muscles in your bladder and prevent them from causing unnecessary contractions. You can use Varuna bark in different forms, including capsules, tinctures, and teas. You can easily prepare Varuna bark tea by steeping 1 to 2 grams of dried Varuna bark in hot water for about 15 minutes. Strain the tea and drink it. You can have this tea 1 to 2 times a day. Varuna bark is also available in capsule or tincture form, which you can consume according to the manufacturer's instructions. It's important to follow the recommended dosage and consult a healthcare professional if you have any underlying health conditions. Number 3. Vitamin B1. The muscles in your bladder are controlled by your nerves because the messages to contract or relax those muscles come from your brain. So if these nerves aren't functioning properly, it can lead to an overactive bladder, or it can make your symptoms worse. Vitamin B1 is among the most essential vitamins for better nerve health. In fact, if you don't get enough vitamin B1 or other B vitamins in your diet, your nerves can get damaged. When this happens, your bladder can't get the right messages, and it might leak or make you pee a lot, especially at night. To keep your bladder in good shape, You can eat foods that are rich in vitamin B1 and also vitamin B12. These foods include nutritional yeast, beef, pork, eggs, wild fish, and sunflower seeds. Eating these foods regularly can give your body the vitamins it needs to keep your bladder nerves in good working order. If you have trouble getting enough vitamin B1 from your food, you can also take B1 supplements in the form of benfotiamine. But before that, consult your healthcare expert to get the recommended dosage and to see if B1 deficiency is causing your problem. Number 4. Kegel exercises. Kegel exercises are like workouts for a special set of muscles in your body that help you control your bladder, also known as pelvic floor muscles. These muscles support the uterus, bladder, small intestine, and rectum. Kegel exercises focus on these muscles, which can effectively help you recover from an overactive bladder. You can perform Kegel exercises in various positions, such as sitting, lying down, or standing. Choose the one that's most comfortable for you. Now squeeze and lift your pelvic floor muscles. You should feel a pulling sensation as though you're trying to lift something inside your pelvis. Avoid tensing the muscles in your abdomen, thighs, or buttocks while doing this. Hold the contraction for about 3 to 5 seconds, then release and relax for the same duration. This completes 1 repetition. Perform 10 to 15 reps in 1 set. Over time, gradually increase the number of reps, working your way up to 3 sets of 10 to 15 reps each. To see meaningful results, practice Kegel exercises regularly. It may take several weeks to a few months to experience the full benefits. Number 4. Bladder training. Bladder training is a bit like teaching your bladder to be patient. It helps your bladder learn to wait a little longer between bathroom trips, which can make it behave better. Sometimes when you have an overactive bladder, you might feel like you need to go to the bathroom all the time. But with bladder training, you can try to stretch the time between these bathroom visits. It's not about waiting for a super long time right away. You start small and then gradually make the time longer between bathroom breaks. So if you usually go every half hour, you can try to wait for 40 minutes and then a bit longer after that. Over time, your bladder learns to hold more pee. It's like training a muscle to get stronger. The urge to urinate becomes less frequent because your bladder gets better at waiting. Number 5. Avoid these things if you have an overactive bladder. The first one is alcohol. Alcohol is diuretic in nature, which means it makes you pee more, which can overburden or irritate your bladder. Another thing is sugar. Sugary foods and drinks, like candy, soda, and sugary snacks, can mess with your blood sugar and make your bladder more sensitive, and you definitely don't want that. Lastly, avoid consuming too many spicy foods, salsa or tomato sauces, citrus juices, and highly acidic and highly processed foods. Thank you for watching and subscribing to the channel. See you in the next video.